president, architect planner, Madam Mogure, and other governing council members. So for those who had any doubt, I think you now see you're in perfect company. I think this is the fifth in a series of COVID-19 webinars that have been covering pertinent issues in the industry. Some of the previous ones that you may be aware of, we have construction industry, which we were looking at how to cope under COVID-19, mounted on 31st March. There was working from home, making it work for you, which was also mounted this month, April 8th. There's the business information modeling, that's BMI for remote working, mounted 15th of April. And the last one that was done last Wednesday, April 22nd, that was business continuity, which was risk mitigation of financial planning for built environment professionals. These webinars are brought to you courtesy of Architectural Association of Kenya. And like you've noticed, they are conducted every Wednesday. Today's topic, which is adapting the informal settlements to be more resilient to COVID-19. And before we delve into the discussions shortly, maybe a few rules. I think we mute all our microphones unless you have the floor. This is just to reduce the background noise that may interrupt the channel we are using to stream this panel discussion. Our panel consists of a rich mix of distinguished professionals who are adequately tooled to give you justice, especially on this topic. The moderator will be introducing these eminent persons shortly. But just as a way of introduction, I think one thing we can learn from the current crisis of COVID-19, if nothing else, is that we are likely to go back to our pre-COVID normal, the life before this pandemic struck. And the challenge now is to actually create a new normal where we are going to be better humans and better versions of ourselves. A new world where the system and institutions we are going to create are going to serve everyone, especially the people living in our informal settlements. And this is where actually most of us are, because looking at our main cities and towns, we're having about 60 to 70% of our population living in the so-called informal settlements. So basically this is more than actually 2/3 of urban population. And it's become the reality of our towns and cities today. And some pundits are actually posing the challenge to us professionals that we are concentrating poor people and economic inequality in these backgrounds. And it's not just morally unjust. These or such areas provide a fertile ground for pandemics to take root and spread. And if you recall, I think we are living in an era of pandemics. Ebola just happened the other day, less than 15 years ago. We had also swine flu, and we are likely to have many more in the coming days. So as we mount the discussions shortly, we need to refocus our policy on sustainable and safe and inclusive cities, where we can then have a chance to prevent the most vulnerable of our populations from being the prime victims of such epidemics. Leading the discussion this afternoon is a town planner by profession and also the chair of the town planners chapter. Please join me to welcome Planner Juliet Rita. Karibu.
Thank you very much, Cyrus, and good afternoon, everyone. I'm happy to be here today to lead the discussions on how we can realign or readapt our informal settlements to be more resilient to COVID-19. But before I start the discussions, I want to welcome our president, architect and planner, Mogore. Please, if you can join us just to give us a few remarks, even just to say hi. Karibu sana, Mogore.
All right, thank you very much, Juliet, for inviting me. For me, it's just to say asante to the team behind organizing this webinar. Certainly, firstly, to the Secretariat, the amount of work that they do on a day-to-day basis, to the Town Planners Chapter for stepping forward to plan this webinar on a very important topic, We appreciate it. And just to thank you to all the panelists and to the participants who are joining us today. The participants are already up to 63, so we anticipate a very lively session. So asanteni, and I look forward to this discussion. Thank you.
Thank you very much. For our participants, I would like just to bring to your attention, because being a webinar, we are holding it more of a discussion. So we'll have brief presentations from our panelists, but by all means, it's going to be a very interactive sessions. So we have a Q&A and a chat box where you can drop in your questions or issues that you feel you want discussed. I'll be checking on that regularly. I would encourage you, when you're posting your question, probably to address it to the panelists that you would want to address your issue. But if it's a general question, then you can just drop it and I'll know how to direct it to the panelists. If you want to something to be brought to your attention, once you click on the participants, you'll be able to raise your hand and I'll be able to see the issue or the concern that you have. So without further ado, I'll introduce the panelists for our discussions today, so that we can get right into the discussions. Once again, I'm Juliet Rita, a town planner by profession and also a transport planner, and I'll be your moderator for the day. So with us today, we have 4 panelists. And I'll start by introducing Jane Weru. If you can put on your camera so that people can see you. So Jane is an advocate by profession. She's a trained lawyer from the University of Nairobi. She also holds a master's degree on NGO management from the Business School or the London School of Economics, sorry. And she's very passionate about informal settlements. And the way she came actually to be involved in work in informal settlement is through a priest that led her eventually to what we know, most of us Kenyans, as Kituo ya Sheria back in the 1990s. She joined Kituo cha Sheria, where she joined as a legal aid in 1994. And here she was able to assist victims of forced evictions in slums. And later she co-founded or helped found the Pamoja Trust. She's currently the executive director and founder member of Akiba Mashinani Trust. And this is an innovative community-led solutions in housing, as well as addressing other land tenure problems. She is a board member of the SHAC, or Slum Dwellers International, SDI, as we commonly know them, who are also members of the Muungano wa Wanavijiji. So karibu sana Jane. Closely working with Jane, we also have Jack Macau. We also know him with SDI so much. He started off as a technical officer for community illumination and mapping for the Kenyan Slum Dwellers Foundation. He is a member of the Muungano wa Wanavijiji, and currently serves as a board member of the same. And he also currently leads the technical support team for Muungano wa Wanavijiji. Karibu sana Jack Macau. With us, we also have David Aubach. David, if you would put on your video so that the participants can see you. David is a co-founder of Synergy, which takes a circular economy approach. So the way you interpret this name basically is sanitation and energy, to provide citywide inclusive sanitation in Africa fast growing cities. Previously, he's also been involved in partnership with Endeavor and the Clinton Global Initiative. David holds an MBA from MIT and a bachelor degree from Yale University. He currently lives in Nairobi and is a fellow of Ashota and Equine Green Fellow.
Thanks for having me.
David.
Santia.
With us, we also have Waziri, Honorable Charles Dadu Karisa, and to other planners in the house. I know the young planners like me, you are also our teacher. How are you, Mwalimu? So welcome so much, Honorable Charles Dadu Karisa. He is a registered architect and a registered planner. He holds the current seat as the Chief Executive Committee member, or CEC, as we commonly refer to them, in Kilifi County, in the docket of lands, energy, physical planning, housing, and urban development. He's a hands-on technocrat, for those who know him. He has a passion for working at the grassroots with the communities. He is a teacher, a researcher, and also serves in the board of the Physical Planners Registration Board, and is also involved in research in Kuri, or the City Lab at the University of Nairobi. Karibu sana Bwana Waziri. So we are going to start off the discussions, and we are going to start with Jack. So Jack, I'll invite you just to share your screen so that we can hear from your side.
Thank you very much, Rita, and welcome everyone. It is exciting to participate, but unfortunately we do not see each other, but welcome. As Rita said, I work for Muungano, which is the Federation of Slum Dwellers in Kenya, and it is a federation that is made up of community groups, all based in informal settlements in our urban areas across the country, all the way from Kilifi, where Waziri comes from, and all the way to Kisumu and through Nairobi. And in our discussion today, I think it is significant that our informal settlements are a very prominent feature of our cities, and therefore then and are significantly different from the formal areas. And therefore, when we start thinking how we're going to respond to COVID-19, then the measures look like they ought to be different. And one of the things that that Muungano is doing, which I think is significant in responding, is to say that the people within informal settlements, many of them may be poor, but are not purely beneficiaries or victims of Corona. Many of them, and many that we are working with, are part of the solution, and it is changing the mindset. So when we look at the informal settlements that we know, like Kibera or Mukuru or Madare, and many others in many cities, that we don't only see people who are waiting for government and other well-wishers to come and help them, that many of them are trying to help themselves and contribute nationally to the solution. And one of the things that Muungano has been doing is to run a daily monitoring system, which I'm going to present to you, about COVID-19 in their settlements. They are currently working in Nairobi, in Kisumu, Nakuru, and are just starting to make entry into the coast region. And the system involves around 5,000 community volunteers who are filling in online questionnaire around their settlements. And we're trying to collate that information and communicated to the COVID response task force of the Kenya government. Now, many of these people, and we call them mobilizers, and there'll be different categories, include community health volunteers, village elders, community opinion leaders, youth leaders, and some general people in the settlements. And a big learning here is, in a health crisis like this, the first level of action is actually community health volunteers. And that capacity surprisingly exists very abundantly in informal settlements, and are able, one, to be very effective in passing information, because on a daily basis, they are associated within their environments with different health interventions. So when there's vaccination, people see them. Whenever there is a pregnancy, they are consulted as a first line. When people get sick, they seek them out. And therefore then that capacity is being transferred to this pandemic that we have. And many of them then are able to tell us, because they also have the appropriate local networks with health centers and chiefs and other government facilities. They are able to tell us with a bit of certainty things like, has there been testing within your settlement? And we have done a bit of a graph for this. They are also able to tell us whether there have been cases of infections and deaths within their settlements. And so far those have been very minimal. I think there's 2 reported in Mukuru and a few in Kibera, but we are monitoring across the city. One significant thing that the communities are doing is helping think about and think about the strategy, and we are relaying this to the task force on COVID response. That given the poor infrastructure that we find in informal settlements, the type of housing, a lot of it iron sheets and other non-permanent materials, that people will find it difficult, slum dwellers will find it difficult to isolate within their homes. And this is compounded by the need for many of them to go to work on a daily basis. And therefore then there has been a discussion within communities on how do we respond if the whole world is locking down and isolating at home and talk about social distance. How does that work for us? And very clearly the message that slum dwellers are passing, and I think it is important in how the strategy evolves, is to say, can we identify centers within our settlements or around us that can be used for isolation, and I have an image over there about possible COVID isolation centers in Kisumu. Now, all these centers are being identified and proposed by community members who know of them. And they can be schools, they can be churches or mosques, they could be libraries or other public health facilities that can be repurposed for COVID responses. So this is a very significant contribution that that the communities have been making. Then, of course, then there's like you see on the screen, a daily report on what different communities are seeing as things they need, whether it is better information, whether it is awareness raising, and it carries on whether people need hand washing or masks and so on. And then there are challenges and people within these settlements, the mobilizers are reporting on these challenges, whether it is things like people's general attitude within my settlement or on the information that is being produced, and whether people are responding to that information, and therefore, and I will not get into the rest of Kenya because it is similar to the presentation on Nairobi. I think the important thing is when you're building resilience is to look at those communities and see them as part of that resilient system and not entirely leave them to be beneficiaries of our good plans, because they understand their settlements, they with their buy-in, then we are able to respond appropriately. I think I will stop there, Rita, and I'll wait for questions. Thank you very much.
Thank you very much, Jack. I'll invite Jane before we take questions on your side, so that she can feed us more in terms of what she's doing from her end. Jane? Jane, are you with us?
You unmute. And you can see me now?
Tilt your camera a bit so that we can see you.
You can see me now?
Yes, now we can see you.
Thank you so much. I think on our side, we've been working, like Jack has mentioned, with Mungano. And we've been working mainly in the informal settlements to try and identify the most vulnerable people. And this is basically because the people who suffer most from the COVID virus, from COVID-19, not the COVID virus, are the elderly, those who have chronic ailments, those who probably are disabled and are not able to fend for themselves. So we've been working with various organizations to identify these groupings. And we've identified about 10,000 households in the city of Nairobi. And what we try to do as much as possible is to monitor these people through the networks that we have, and also to try and raise funding or money to be able to support them. So we work closely with a number of women, and I'm glad to say that your president, Mrs. Mogore, is one of the ladies that we're working closely with to start a fund called Mama kwa Mama, where we are raising funds from women across the country to support other women. So far, we've been able to get food for about 900 households. And we're hoping that this number will increase in time. Apart from that, we've been working closely with Nairobi Metropolitan. And I think one of the key areas of creating resilience, sorry, a bit noisy here. Creating resilience is to work before the crisis begins. I think that's one of the major lessons that we must have, because we cannot create community organizations that will support the people when a crisis or a pandemic happens. You must have worked earlier to create those social networks. as Jack has said, that will be able to support the community that is in crisis. Again, you'll not be able to bring in water, you'll not be able to bring in, to open the roads so that ambulances are able to enter into a settlement that is in crisis, unless you have done prior planning. And so one of the biggest lessons that we learn is that we should not wait for crises to happen in order for us to respond. And this lesson is very, very pertinent in the case of Mukuru. So we've been working with the new metropolitan services to begin to implement the work that had been done by under the SPA consortium, the SPA planning process, the special planning process in Mukuru, where we have planned, provided for the provision of water, sanitation, and road services to the people of Mukuru, Ruben, Jenga, and Biwandani. And because of this planning, the Nairobi Metropolitan has made a commitment to the people of Mukuru that it is going to bring the necessary resources to ensure that toilets and water services are provided at the plot level. Mukuru only has 3,000 toilets. So even if you're talking about hygiene and even washing your hands when there's very few access to water, it doesn't make sense. So that is a commitment that has been made. And I would say that in the days to come, with us not returning to normal is for us to plan all the informal settlements of the city and to ensure that services are brought so that we can have resilience. Thank you. No, sorry. I can't hear you. What has happened? I can't hear.
You can hear me now?
I can hear you now.
Okay, just before you go, you mentioned about special planning in Mukuru. And just to have you elaborate more, is it that you're preparing a physical or spatial plan for Mukuru, or what is exactly happening so that you'll be able to make sure that they get the water and education provided to these homes?
Yeah, what happened is that you can hear me?
Yes.
What happened was that in the year 2017, the county government of Nairobi declared Mukuru as a special planning area under Section 23 of the Physical Planning Act. And what that meant was that the county government was required to develop spatial and sectoral plans for the whole of Mukuru, an integrated plan. So we started planning and identified, we created 8 thematic areas. Amongst them was education, health, water, sanitation, energy, housing infrastructure, roads and drainage. And I think I've said education and health, and then we also looked at the land issue. So we created 8 planning consortia that were comprised of people from civil society, private sector, and the government. And each of these 8 consortia was headed by a county department head. And each consortium has now, each of these 8 consortia have now developed sector plans, both sector and spatial plans for their sector. So we have detailed water and sanitation sector plans and spatial plans for the whole of Mukuru, Ruben, Mukuru, Jenga, and Biwandani. And those are the plans that have now been adopted by the Nairobi Metropolitan, and they've made a commitment to ensure that the plans are implemented almost immediately.
Thank you very much. I think it was important for the attendees for you to elaborate so that they can understand the special planning concept. Thank you very much.
Yes.
I'd like to invite David. David, if you would share your screen with us.
Great. Sure. Let me share screen. Great. So Great. Good afternoon, everybody. I'm going to just walk you through what we are up to at Sanergy and Fresh Life. We've worked very closely with Jane and her team with the special planning work, and maybe this gives a little bit of color on what's happening from an implementation perspective too. I just wanted to quickly share sort of just the overall sort of perspective right now for the members of AAK. There are globally, this is one of the biggest systems challenges and design challenges that we face. There's about 1 billion people living in informal settlements right now, and this will increase to 3 billion by 2050. Of those, it's pretty consistent. You find in developing cities, about 70% of residents in informal settlements will lack safe sanitation services. Globally, this kills 1 million people a year, and economically, $260 billion lost. So in Kenya, we have about between 8 and 10 million people living in informal settlements, and similar numbers. Over 60% of that waste is not being safely managed. 17,000 children dying each year, and 1 to 2% of Kenya's GDP is lost in economic productivity because of sanitation-related disease. And COVID-19 is creating new threats to these densely populated low-income areas. And it starts, of course, with just the threat of the virus itself, right? But then second is that we have the lack of access to healthcare, or very fragile healthcare services. And so if people get sick, there's obviously a greater chance that they end up getting that it becomes a difficult situation. And if the situation indeed, if our healthcare services are at their max, at some point it becomes challenging on which, who gets beds and things like that. And then we have these, the difficult living conditions with no functioning sewer systems. And so second order diseases potentially can spread too. And this is really scary with COVID-19 in particular, because we've seen evidence of it in feces, but that's typically been in more developed places. And so those are typically that waste ends up in sewers, and then you don't see it again. Whereas in informal settlements, if we're not getting, often there is waste that is not leaving the community. And so that potentially poses a greater risk. And then of course, at a little bit more of a macro level, if we go into a prolonged recession here in Kenya, and people don't have incomes, they will not be able to afford to buy the essential hygiene supplies, such as soap, that they need and such. And so, so all of these things make COVID-19 a really significant threat to the residents, to all Kenyans, but especially residents of informal settlements. What we're doing at Sanergy, Fresh Life, is very much in line with what's been spoken about already by Jane and by Jack. It's thinking about, okay, in this situation, how do we come up with resilient solutions? And first of all, we have to make sure that people are getting the essential supplies that they need to protect themselves. And so, soap and water for hand washing, hand sanitizer service, disinfectants. And this is, in this we really feel is important to prioritize in the short term, but just in the short term, as we weather the COVID-19 storm. But at the same time, what we need to do is also provide essential services built into the residential situation. So this means making sure that sanitation facilities are being put into the residential into the residential context. And this actually makes it safer for residents in place. You'll hear a lot of proposals out there right now that talk about the importance of getting, of communal hand washing stations and such, but which is important on one hand, but on the other hand, promotes challenges around people congregating. And so how can we minimize that as much as possible? And secondly, you think about with the curfew that we have in place, Josiah Omoto of the Umande Trust has been really vocal on this, but with the curfew in place, when people have to leave their residential compounds to go access a toilet at night, this is, they put themselves at risk, and we have to be really mindful of that. And so when you have people going to communal toilets, they can't access them at night, or they have put themselves at that risk. And so we think it's extra important to make sure that people are having sanitation facilities within their residential compounds, which of course is what any of us want. It's a dignified, hygienic, safe solution. And this is what our organization does, Sanergy, often known as Fresh Life within the community. So we build low-cost, affordable sanitation facilities. We manufacture them actually in Nairobi, in the industrial area, and then we work with landlords in particular and those who control the residential plots to be able to ensure that they're providing safe sanitation services to the tenants. And so they end up prioritizing the use of land to put in a hygienic toilet. And what Fresh Life commits to is helping those toilets stay clean, safe, and open. And so we work really closely with the local government to make sure that we're fully in compliance. And what we commit to is providing a frequent, safe, and regular waste collection service. You can see in the slide, we do the collections first of all by hand carts because of the access issues that come with the informal settlements, and you can't have truck access. And then secondly, we have waste collectors. They're all youth from the communities who are hired on full time, and they get, they have everything from proper PPE, inoculations, medical checkups, and here, especially during this COVID-19 time, we have significantly enhanced health and safety measures, including regular or daily checks on people's temperatures and their health to ensure that they're able to go about their work during this time. And and it's been interesting because with the lockdown in place, partial lockdown in place, I should say, we're collecting twice the amount of waste than we were in March. So when people are at home, they're going to the bathrooms at home, there's more waste, but so the service is more important than ever. What Sanergy also is able to do is to guarantee that the waste is safely treated. This is a huge issue that all informal settlements face. For a number of constraining factors, often waste doesn't get to the right treatment centers, and this is partially because of licensing. This partly due to transport costs. But instead, we're able to, actually take the waste to a large processing plant and have it treated. You can see here. So this is one of the toilets. This is a Fresh Life toilet. It's great. It preserves water. It's a waterless toilet. It's designed to be able to take about 100 uses before it's filled up. It's a urine diverting squat toilet. So this is more for the engineers on the call. But separating the liquid and the solid waste reduces smell significantly. It is a squat toilet, which we have found that people prefer, but we also have designed an in-home toilet too, so a seated toilet, which people can also use. And so these are able to be installed within a day. You can see we here have a manufacturing site in the industrial area. And what happens is that the residents are investing in this. They're paying a small amount to be able to have these services. It doesn't cover all of the costs, but it takes on a market-based approach there. And when I say it's the residents, it's the landlords who are paying for this. The waste is then being safely collected, and then is being taken out of the community. We have a team, as I mentioned, that works with the government and the community to ensure that everyone is on board, and we're listening also to their ideas on ways to improve these services. This gets taken out to a waste processing plant in Machakos that's actually still within the greater Nairobi area. And there it's being treated and converted into useful agricultural inputs. This ranges from organic fertilizer, which is really valuable for horticulture. It's KEB certified, and then also insect-based animal feed. So we rear a colony of what are called black soldier fly larvae, which are flies that eat organic matter, and when they get big and fat, and we harvest them, they're 40% protein. And so this is an effective substitute for omena. These products are really valuable for feed millers and really important at this time when we're facing potential food security threats with the restrictions on imports in particular. So right now we serve about 130,000 residents across 11 informal settlements in Nairobi. We also collect about 10,000 tons of waste. That was last year, and all of it is safely treated. And just as importantly, we're spurring the city's economic and social prosperity. We have about, across all the work that we do, we have about 300 people on staff. We've started to do some work out in Kilifi also, and exploring that, and as well as in Kisumu too. And we have about 2,500 operators running the toilets. We have and then we work with over 1,000 farmers too. So at this time when of high unemployment, it's also looking at resilient ways to be able to create good jobs. And I'm going to stop there and move on to the next speaker. Thank you.
Thank you very much, David. That was very informative. From the county side, we'd like now to hear what serikali, or what we refer to as serikali ya mashinani, the county government, is doing. So karibu sana, Bwana Waziri.
Thank you, Rita. Good afternoon, everyone. Been a pleasure to hear from very able people as my co-panelists. I think, as you rightly put it, I'd wish to engage from a slightly different perspective. This is a public sector, and I will not do a one-off thing. So I will, at this point, maybe I want to do just an engagement on the problem context, what it is we have encountered as an intervening agency at the county level, also working closely with the national government. I sit in the disaster management committee by virtue of my docket planning, together with the devolution team. There's the public health, etc. Now the lead person in our team is from public health for obvious reasons. COVID-19 to a larger extent is a public health matter that then touches on many other cycles of life. So it is important that we keep reminding ourselves on that even when we look at the informal settlements in the matters COVID-19, to a large extent, then we are looking at the issue of public health in the informal settlement and the challenges that come with it. Having said that, there are some realities that we have to encounter as we look at this pandemic and seeing ways of how we can realign the informal settlement. And our first concern is informal settlements as a very unique context. Unique in such a way that most of the terminologies and concepts that are used elsewhere in this effort may not apply there. They may be very abstract or vague. For instance, when you tell someone in the informal settlement, stay at home, the notion and concept of home there is very different. You may by extension be telling this person stay on the streets. So there's a very thin line sometimes between home and the streets. Because with half a step, when you tell these people keep social distance with the sort of densities we have in the informal settlement, this turn out to be very abstract sort of concepts. So this affects a lot when it comes to intervention from operational dynamics. And related to that maybe, and I will pause, we keep engaging after that, is the place of the informal sector in mainstream statistics. You know, once you are left out of mainstream statistics, to a larger extent, you've been left out of whatever planning and meaningful intervention that may come your way. This, when you look at the government structure, for instance, is very quick to see how adversely it affects the agenda of the informal settlements, because it means you miss in the statistics, you've missed out in the budget allocation, and therefore hardly anything will come your way. So for us who have had privilege of working with the informal sector communities, we've taken upon ourselves to really push for the entry of this sector into our formal government statistics for planning and budget allocation purposes. We've reached out to partners both in private sector, civil society organizations, multinational organizations, and probably later on we will highlight how we've gone about those. But as we speak now, we did launch our relief services about 2 weeks ago. This entails food items. It entails non-pharmaceuticals items as well. It entails other basic needs from a day-to-day, like water. So dispatching water boozers to some of the stations and trying to see then even chances of configuring semi-temporary mini grids for distribution of water. Because as one of our presenters said, one of the things you are endangering the rest when you go in to intervene is the whole issue of assembly of people, people gathering and not observing the social distance and all that. So even as we reach out there, we want to see we get as close as possible to the households and individual targets than just have them assemble in common areas. So probably I will leave it at that, and we continue engaging. If I get an opportunity, I will highlight some of the findings and probably areas for engagement. Asante.
Thank you very much from that. We've had some questions coming in that I would like to put to the panelists so that you can now go to a more engaging kind of session. So we have a question from Nathan, who is asking, this is directed to Jack, and he's asking just if you could expound on the preliminary issues you're facing as you're trying to assist the slums or the informal settlements adapt or mitigate against COVID-19. Basically, the main issues that or challenges that you're currently facing, and probably how you think planners, and I would like to add how you think professionals in the built environment can come in to help probably the slums be able to mitigate against these issues or the challenges.
Okay, thank you, Rita, and thank you, Nathan, for your question. I think some of the initial challenges that we experienced was one, the right information was not getting to the interior of settlements. It was getting to government facilities and to the areas near main roads, but there was a challenge getting information right into settlements. So that was a challenge. I think a lot of groups have stepped up and come now, sorry, and I've addressed that. And then right now, as communities are looking to identify possible isolation centers and see how to repurpose them, then they becomes a very big opportunity for professionals in the built environment, whether it is planners, whether it is architects and other professionals, to see how these places can be repurposed, identified, and strengthened. And then there's the whole aspect that that Jane was speaking about, and Jane was saying if there are plans for infrastructure and other plans, then there's a willingness in government to invest, but those plans need to be generated, and this pandemic then I hope is a call to action to all professionals that beyond their normal work, that contributions in planning and design and so on are very valuable for us as a society. So thank you very much.
I'd like to ask you one more question, Jack, before you go. So just as a follow-up, Jane mentioned so much about what they're doing in Mukuru in terms of the special planning area, trying to get facilities in. And one of the questions that is being asked here, which is related to that more or less, is how you're getting in the county to buy in or more or less commit to undertaking whatever they have said they're going to do in support of implementing what all these plans have been done for Mukuru. So how are you getting the county to buy in or commit to execute or implement these projects?
I think Jane is, I work very closely with Jane, but I think she's best because she's been leading on the engagement with the county.
Because Jane has stepped out for another meeting, so she's not with us now. But
okay.
If you're not able to answer that, that is okay. It's also something that probably we can hear from the side of Kilifi, how they work with initiative coming from the community, and probably how they come in even to partner with private sector to help implement some of these projects.
Rita, it is fine since I had not noticed that Jane had stepped out. And I think from the Mukuru example, for a very long time, then improvements in slums were done as a side thing and were not in the main integrated plan of counties. They were sort of a do-good thing that happened on the side. I think with the Mukuru special planning area, then the county was saying, we will take up Mukuru and put it within our planning regime and integrate it into the county's integrated development plan. That's where it ends up. And then we will ask people within the city, beginning with the universities, University of Nairobi, and even private universities like Strathmore and others, and then civil society like ourselves, like Sanaji, and so on, to come and bring our different areas of expertise. It also becomes a very big opportunity for professionals, whether they're in private sector or whether under the umbrella of AAK and other professional bodies to come and participate. So yeah.
And maybe, and if I could just build on what Jack's saying, so that, I mean, that's definitely from the grassroots level up on how to make sure that's happening, and then engaging the county. But then there's also a couple of important things that are happening on the national level. And so, and I do think it's very important to be working on, to be coming at it from multiple different approaches onto the county. And so at the national level, you see that, so WASREB, who's the national regulator, has in their last report, impact report, which they do every year, they have included a pro-poor KPI, so measuring each county against each other effectively on whether pro-poor strategies are being adapted by the local utilities. And so a little bit of for those who are succeeding, a little bit of pride, and Kilifi and Malindi are doing extremely well on this, and it's a good way to apply a little pressure on Nairobi. And then secondly, in November, there was a big event called Kenya San, the first of its kind. And what happened on that is that they officially, there's a communique by the Ministry of Water, Sanitation and Irrigation that all the utilities are to expand their mandate to be not just sewage companies, but sanitation. And this is really, it's just one word, but it's really important for the residents of informal settlements, because previously the utilities were responsible for only where there were sewers. And if there's no sewers in informal settlements, then those people were not going to be served, unless, as Jack mentioned, unless it was essentially through a goodwill project. That changes that mandate and puts the obligation on the utilities to ensure that we start providing that they have to be providing services to the residents of informal settlements, which we think is a really huge important step. That's now, it's being ratified this year, but that big proclamation was a key way of changing the landscape for the rights of residents of informal settlements.
David, just also maybe you can highlight in terms of maybe how you get to work with the county government in terms of getting probably approvals or permission to put up your facilities, and maybe how you go about getting the land itself just to set up these facilities, because we all know there's, in some of these places, there's basically no space even to squeeze in a toilet. So how do you go about this?
Yeah, well, so this is, so just to give you a little history of Sanergy. So initially, the model was focused on working with commercial entrepreneurs. They were the ones who had to gain access to the land, and that was the case. That worked up well for a while, but then we realized, there was a lot more demand from residents of the communities that they wanted the toilets in their residential compounds. And so what we did was that we started to develop and engage relationships with the landlords, who are operating the residential compounds there, and especially the ones who are living within the compounds, like immediately upgrading their sanitation options made a lot of sense. And so we as a company, so we have permits to be able to run sanitation facilities. And then, but in terms of like the usage of land, that falls to the community, and they're the ones who determine that. And so that's how that's been structured. And so it's worked, and that's worked in Makuru, Mathare, and other places too.
Okay, so there is one last question also here, just to ask you if you're offering any of these services in Mombasa.
So I'll go first. So fresh. So we don't operate in Mombasa yet. We only have sanitation facilities in Nairobi at this moment. We are looking, unfortunately, the other way towards Kisumu for later this year. And then also, as I mentioned, we've started to do some work, not on the sanitation side, but on the waste management side in Kilifi.
Okay, thank you very much. Honorable Carissa, if you could just come in a bit just to answer some of the questions we have here. So of course, the first question which I'll put back to you is how you're working with these grassroots communities. if they come up with initiative or projects, how are you supporting them as a county? Are you unmuted, Honorable Charles? Carissa?
I am available.
Yes.
I am here. Thank you. There are several pathways that we get to reach out with these target communities. First is through our respective departments. We have about 3 departments that have a strong link to communities. That is trade and cooperatives. We have the disaster management, and we also have agriculture through their extension services. So there's already some rich database building through these projects. And you will find that through what the county runs as a microfinancing outfit, popularly known as Mbegu Fund, this targets the small business people by granting them interest-free loans. So through this, already there's a good network that has come in. Then we use guidelines that cascade to the county governments from the national government, just to make sure that everything is well coordinated. Remember, there are programs like TSIP for the informal settlement improvement, and also participatory slum upgrading project by the Habitat. So through this, again, we've been able to build very strong networks within these informal settlements. And you know, the entry point, whether it's tenure, whether it is infrastructure, at the end of the day, it opens up to broader engagement. Then lastly, we have the investors in Kilifi through CSR. We've been able to push them to adopt some of these communities within their vicinities. And that has worked well because the investors have been able to partner with us in establishment of vocational centers that work as centers of excellence. So a good example is the Centum. They have done one at Takaugu, and many others are on the line. So there's a good link so far. It just needs that consistency to push forward. Yeah.
Thank you very much. Just on another one to do with the legal registration policy issues, we have to appreciate that after we have gone through this pandemic, probably we'll start thinking about new ways of doing the way we do planning, development control. So we have many questions which are related to that. So I'll try and summarize them just into one questions in terms of pandemic affecting how we do long-term or medium-term registration or policy interventions now at the county levels, or in terms of how we do planning, development, and development control. And also related to, we have to appreciate also there's usually a strong linkage between how we do development and public health in terms of how public health issues affect us in terms of planning and construction guidelines and all these policies that we come with after. So maybe you can just shed some light in terms of your thinking of how this is going to affect us in that way.
Okay, it is a matter that we are engaging widely with the national government, and I think some of the propositions are already in place, especially touching on land registration and transfer. I think there are certain things that have been waived as we speak, but I see a catch-22 to that, because we may gain in one way and lose big time. Especially land is delicate, so matters of fraud related to land also, we may see those expanding. But locally, again, what we've done, we've been able to offset certain things like sales, the licenses and all that. We've been able to do waivers for the small time actors, like the people who are the riders, the border people, some of the transporters, the small scale traders. There's a bit of that. So we've engaged because when you look at the revenue streams affected, they fall in different departments. So it's been a wide-based consultation that is interdepartmental. And just this morning, we had a cabinet meeting where we then endorsed some of these resolutions. Yeah.
Thank you very much. But from your point of view now, speaking to you as also somebody in academia, in terms of, do you think this is an opportunity now that we have to basically approach how we do planning going forward in development? Given that also looking back, years back, probably when we had the World War, the Spanish flu, this was also an opportunity for city planners to replan the city. What do you think about this pandemic in terms of it being an opportunity for us?
Well, I wouldn't really look at it as an opportunity to think differently, because that thinking is already there. Perhaps it is time now to validate that thinking. Otherwise, we have a rich assortment of alternative settlement models. We have reconfigured these informal settlements in ways that to many may look like very utopian. But I think some of those things, you look at them now against what is happening, you can begin to see the logic behind this. So I think it's about we pushing, whether you are in the system or outside, just dusting wherever this information is and begin to leverage the governments at both levels to begin to adopt some of these things. And I like what David is doing, because sometimes, many times, not sometimes, governments, they don't hear, they see, they read. So many times our engagement, if it is practically based, we are likely to go far. And the few of us from this field that sit at strategic decision-making level, I think our work is cut out. Yeah.
Thank you very much. Do you have any information as to probably, are you getting any funding from the COVID-19 National Fund as counties, or how is this going about? There's a question to do with that in terms of if you're receiving any amount of money from the COVID-19 fund, National Fund. That's the first one. And whether if you're receiving this fund, there's any amount going to the informal settlements.
Thank you. Yeah, it may not be mature enough for me to say for certain that we are getting, but what happened, two things happened. When this thing was declared, we as a county government, of course, went into a supplementary budget and made savings to the amount of 200 million Kenya shillings to go towards this pandemic. But as we were doing that, also the national government sent out requests for county governments to compile their needs. So different key departments like water, health, were able to come up with these with these projections that then we submitted to the national government. We are yet to know whether that will be funded in full, in part, but that information was compiled and forwarded. Okay. Definitely, the informal sector was accounted for. I personally did that. So we have an entire database of the informal sector through the different committees, especially for the vulnerable within the informal sector. This database is there, and it formed part of that budgeting. Yeah, thank you.
Thank you very much. Jack, Macau, are you still with us?
Yes, yes, Rita, I'm still here.
Just a question in terms of a follow-up. We had a discussion just about the funding, and there are questions here, and the main reaction or the main query is in terms of slums. We have always associated slums or informal settlements with getting handouts in terms of short-term relief, but what is the way forward? Because we cannot stay in a situation where we are still depending on handouts, even years to come, 10 years to come, 20 years to come. So in your opinion, going forward, what's the way forward in terms of building the capacity of these settlements, building the capacity of these households so that they are self-reliant and not relying on handouts?
Yeah, very deep question, Rita. And I think that there are several dimensions to it. One, I think as a society, some things need to change. We are very comfortable paying our house helpers 10,000 shillings or 15,000 shillings. And then what that generally means as a monthly wage is that the only accommodation they can find is within a slum. So there's that relationship and that disparity between income groups that is a reflection for society to think about. Maybe pandemics like this provide the conditions where people have those debates and think about those things. And then I think that there's a dimension where, and I saw architect Mukeku had mentioned it in one of the questions, where actually planning and implementation in informal settlements is not really seen as a priority issue. It hardly ever becomes even an election issue. We're not very emotive, so we don't make big investments, the necessary investments in informal settlements to turn around these informal settlements, and therefore then the residents of these settlements are just remain depending on whatever little handouts they're given. So I think it is a moment of reflection for all of us. Thanks.
Thank you very much. Related to that, there was a question by Beatrice, and this was about to do with inequalities in terms of, she says that coronavirus all across the globe has basically widened the reality of the inequalities between in the society. So as we go and look at this issue, and also related to this question, there was a question on how we can have basically as a way moving forward post-COVID, a policy on Rudi Mashambani. That is, I don't know her name or his name, HP Probok. But the Rudi Mashambani concept is basically offering more opportunities in the rural areas and having people not coming in or migrating into the city, hence reducing the population in the informal settlements, yeah? So in terms of, because all these issues about to do with inequalities, yeah? And also access to opportunities in rural areas versus urban areas. So any comment onto the two issues, inequalities in urban areas in terms of opportunities, and also inequalities looking at opportunities in the rural areas versus the urban areas as a way of moving forward, maybe in the long term. Jack?
I liked what David had said earlier when he said that the people in informal settlements, the impacts of COVID will be greater on them than the rest of society, even after the pandemic has passed. I think that was one very significant thing that David said. And then coming to the issue of Rudi Mashambani, or people go back to their rural homes. And I know Honorable, also being an eminent planner, can also contribute to it. I think it is.
At that.
Yeah, I think it is. It has been tried. It's very difficult, but I probably should allow Honorable, in his other hat as a planner, to speak to that comment.
Thank you, Jack. Definitely, it's not an easy nut to crack, because it's not about just writing laws and restrictions that suddenly will profile people and make sure they come back home. We need to open the right opportunities at home. And if you look at the whole aspect of aggregation, our human settlement landscape has been leaning more towards the primacy sort of depicting that in terms of settlement patterns and economic structure. So I think there's a lot we need to do, first of all, in terms of planning by reorganizing our urban landscape and attaching that then also to the economic restructuring as well. If you look at most of the counties at the moment, whether by conviction through maybe certain conditions that they have to meet for them to access some monies, I think there's a bit of an improvement in terms of planning. But also, when you look at the budget structure, there are some inbuilt affirmative measures within the budget. Like you see, this should go to the youth, this percentage of the budget should go to the women and all that. When you look at our county assemblies, the minorities and persons with disabilities got specific reservations there. And therefore, that is meant to ensure, even when it comes to policy formulation, these categories of peoples are also taken care of. And through some of the consultancies that we launch at the county level, we've exposed some of our people, elite outside there, just to come closer home and engage. And as they deliver on their consultants, they are encouraged to invest, and slowly they begin to print their foothold here. So it's going to be a gradual process, but it has to begin now, and we take momentum with the policies, our new urban laws and all that, and make sure that planning begins to structure the functioning of our society.
Thank you very much. That question was asked actually from Sarah Masaki, who is also a planner. Thank you very much, Sarah. So there's one more question going to Jack in terms of, this is from your friend, Christine Moshiri. And she's taking you back to the visit that you had to India in 2017. And she says, we saw communities live and work within the informal settlements. Our Kibera people work as gardeners and nannies in Kilimani and elsewhere, and have temporarily been rendered jobless, most of them. So any foresight in terms of how they can reconfigure their economies just to stay afloat with the stay-at-order, basically with the stay-at-order regulations that we now have. Any thoughts into how they can adapt themselves or realign themselves now to work from home?
Yeah, and I think that is very significant, and it's good to hear from Christine. And we visited Dharavi in Mumbai some years ago together to look at how they have planned the transformation of the settlements, and some of the investments are beyond, because whenever people think about slums and improvement, they see it purely as a housing endeavor and then infrastructure to support the housing, which are important. But I think our thinking needs to go a little beyond. And what we saw in Dharavi were very small cottage industries run by very ordinary people, many of them even in sandals. And I remember one particularly that was producing handkerchiefs. And those handkerchiefs were being produced very locally, but then being packaged and were being exported. And very interestingly, if you go and buy those small handkerchiefs that school children buy, they actually come from those very small cottage industries in one room. Now to get to that point where this gentleman or lady in sandals is doing that, then there's deliberate economic planning by someone that accompanies slum transformation. Because we can see, even where upgrading has happened, the physical, where economy hasn't changed, the conditions deteriorate very quickly, and the place may be built with stone, but it starts to resemble a slum. So it's a very significant thing that that Christine is bringing up. Thank you, Christine.
Thank you very much. I think now we'll have one more round of answering question and putting in our parting shots so that we can wind up. It's already going to almost 4:30 in Nairobi. So maybe David, you have introduced us to in terms of what you're doing and the technology that you're using. What we'd like to hear is probably, is there any initiative, first of all, to transfer this technology to people who would want to replicate it in other places in Kenya? And how do they get to work with you guys?
Yeah, no, please reach out. I think my email's there, but you know, we're always interested in working out how to do this. I think it's important elsewhere. It's important to note that we've designed this at this stage for the urban context. You know, so for where people are living quite close together, and so that you can collect waste efficiently, which is really important. Also, we do think that urban sanitation is quite neglected, even on the sort of the spectrum of just sanitation within Kenya. There's been a lot of emphasis on the rural side, and you know, as people continually move into cities and live close together, there is much greater risk there. So you know, we're very open. We're very open to partnership opportunities, and you know, and so please reach out, and I'd love to be of help.
Thank you very much. One last one is in terms of the kind of technology that you're using. In the next like 5-10 years, do you think this is where we need to move instead of putting our efforts into centralized systems of sanitation, especially in informal settlements?
Yeah, I think like, I mean, I think that, I think that you can see what we're doing is similar to what you maybe have seen with off-grid energy, you know, which is to say, at first there's ideas of like, well, shouldn't we have like centralized power and all of that? But then you realize that there's actually like, you know, first of all, there's more efficient ways to be able to do this. There's ways that that enable people to get the services they want, and you know, and which is you know, a clean fresh toilet where they are living, and then do something with the waste, you know, and actually help us address other social challenges that we face and help help our economy prosper that way. And so you do see you do see a world where like, for example, I mean, what we do is like it's a waterless toilet, so you don't so you save hundreds and thousands or millions of liters of water every year by not having flush toilets. Water scarcity is going to be a real issue as Kenya grows. So thinking differently, but providing people with the services that they demand is something that I think is an important way for, especially for architects and designers to think about.
Thank you very much, Honorable Carissa.
Probably I will just have 2 points to make.
Just before you put in your parting shot, there's one question for you here that we haven't answered in terms, there's a question on whether Kilifi County government have a permanent solution in waste management, like developing sewerage lines, either now or in the future.
Thank you. We are on the right path, I must say. Looking at Kilifi, it's not possible to say leapfrog from on-site sanitation where we are now to 100% sewer network reticulation. We've chosen a hybrid or a stepped sort of approach in that we will prepare, and we've done the feasibility studies through our water companies and the World Bank. We will go the route of composting stations first. And this later on will be connected to the wider network of sewerage. So we've done the first bit of securing land, doing the feasibility studies. Now we should go ahead and set up those composting stations. Later on, there will be like the micro treatment when we shift to the pure sewer reticulation network. So that's what I would say for Kilifi.
Thank you very much. I think also when people post this question, I think most of the time they're just thinking about the urban areas, because if we are talking about Kilifi, then we are probably looking at parts of Mtwapa, Kilifi town itself, and Malindi, because we have to admit your county is very big in terms of the geographical locations. So it's not practical, even if we had the funds to do reticulation for every part of the county at once. Yeah. So I think that's also something that we have to appreciate, even as we thinking about interventions. Probably this will start at the urban areas in terms of sanitation, and probably moving down, as you likely said so. So in terms of the one last thing, I know we always like to put it to the government of what they can do for us. Yeah? And I would just like you to tell us in terms of what are the common misconceptions people do have in terms of what counties are doing? Or do you feel that we have realistic expectations from the county governments? And what can we do? How can we come in also as professionals to help the county?
Okay. I think the Serikali mentality is well known to all of us. Every other problem finds its way to the government, and once it's there, then you are expected to fix it. But I think we are learning the hard way because people who have sat back vis-a-vis those who have taken a proactive approach to things, I think the difference is evident. And to a larger percent, I would say it is a lack of communication, the right communication. Because even where we are now with this pandemic, there's a lot of outcry out there. Yet for each and every of that, there is information enough to give satisfactory answers to these people. But I think we need to also embrace new ways of communication. Right now, it's possible to do very rapid communication and reach out to each and everyone, because we need to to make people feel comfortable, to build faith that they are fine with the government as a partner beside them. But the lucky thing is that, you see, we were not born in these offices. So whoever person sits in government also is a member of a community somewhere. We've also tried in our own small or big ways to spread word. Do not underestimate the power of social media. We learn a lot from it. So there are particular forums, you know, when you go there, you'll come out a better person in terms of just the outlook to life and all that. And I think a step at a time. If things go well, by the time we are done with the third cycle of devolution, I think we'll have made a significant milestone with this.
Thank you very much. Jack? I'll just have just one question, and then I'll let you give the parting shot.
All right.
So you're one of the person who have been in informal settlements the longest, yeah, in terms of working with them. And there are a number of areas of interventions that you've already addressed. Some of the areas that have continued to be a struggle in terms of how you address them. And I was just wondering, in terms of if there was one thing that you would, or one question or one issue that you're quite tired about hearing all the time, yeah? One of the concerns or one of the challenges that you're basically fed up of hearing, yeah? And if you were asked right now to be resolved so that you never hear about this issue again, what would be that one issue? You're muted. You need to unmute.
Oh, sorry. I was saying that's a very challenging question that you have asked me, and I suppose what I would like to go away completely is the thinking that the informal settlements are illegal, and if we continue thinking about them as illegal, there's a solution that way. I think we need to acknowledge that they exist, whether we call them informal or illegal. Someone has got to make an investment to improve them. So that would be my biggest my pet peeve on informality, and to say it is part of our society. Maybe we try and make it better.
Okay, perfect.
Yeah.
So what's your parting shot?
Well, my parting shot, I'll probably end where I started, that the residents of these informal settlements are a very important part of the solutions that we develop for COVID-19, but generally for a whole lot of things. And out there in the informal settlements, there are some beautiful things that are happening. We're seeing landlords who are saying, okay, don't pay rent now. I'm not sure it's happening in the rest of the city. We are seeing people coming together and donating little money to buy water and soap and so on for their hand washing stations. So I think people in informal settlements are pretty much part of the solution, and we should not make them purely victims and beneficiaries of our efforts. So thank you. Thank you, Rita.
Thank you very much. We also have gotten some parting shots from our participants, and one says, pandemics have always shaped civilizations, and this is how we should see COVID-19 cities look like in terms of changes in urban planning, and start more conversation about urban governance. And Sarah says the planning professionals should come up with tailor-made designs and approval processes for low-income households. Basically, the sentence is not complete, but I guess it's in terms of having this as an opportunity to really look at how we plan and develop low-income areas. So I would like to ask Christine if you would put for us the shop Kokon. We have an initiative as AAK. So we have two things that you're doing as AAK. We are working with SHOFCO in terms of raising funds, so you can contribute through the M-Pesa pay bill. It's there on the screen. And this money is going out to feeding program for children out of school, community health clinics, sensitization, and safe houses for women and children. As AAK, we are also working on the COVID-19 response team. So feel free to share your thoughts in terms of what we can do further in terms of making our informal settlements more resilient, so that we can incorporate this in our concept paper, which we are going to present, and probably we'll see whether we can organize another webinar to discuss some of the interventions that we have already connected and come up with. So I would like to invite Cyrus, who is our secretary to the Town Planners Chapter. Secretary Cyrus, are you there with us?
Yes, Chair. Thanks. Yeah. Thanks. That was powerful, I must say. And just been listening into all those views and getting to learn a lot, actually, from the rich experience of our panelists this afternoon and going into evening. And I would like to actually acknowledge everyone and everybody that has been behind all this to make this successful. I have to appreciate the Governing Council of Architectural Association of Kenya, led by Madam President, Madam Mugure, the chapter council, Town Planners Chapter, the AAK Secretariat, I mean, the people who've been behind to make sure everything goes as planned, and our audience. I think they've numbered 70, 80 and counting, and I think they've really given us the background support and engaged us with the various questions that our panelists have been answering. Specifically to our panelists, I would like to recognize Jack Macau, I mean, from SDI, David Auerbach, I guess I got that right, in German.
Very good.
Yes, and Mwalimu, David Dadu, and lastly, Jen Weru, I mean, who is dealing with these issues, social justice in informal settlements. Finally, to our chair, I think who's been an excellent moderator for the session, Madam Juliet. I must say she was my classmate so many years ago, and I'm happy with how she turned out. Thank you so much, everyone. And I would like to say, I mean, all these contributions, tidbits, and all those, I hope they're going to be consolidated in a coherent policy framework that is going to be in support of our informal settlements. I think they've been left behind far too long. And I think all this needs to change in the new dawn. I think we are not going back to where we were. We are going to be better humans. So to everyone else, a good evening and cheers until next time. Bye. See you.
Thank you. Bye.
Bye, everyone.
Bye.